The world is a big place, and physically, my body reminds me of that, just how big this world is with all the travel that I've done recently in the last several months. You know, one of the things that I realize is that it is so easy for us individually to get so engrossed in our day-to-day routines and the issues that we face daily that many times we become isolated or insulated from what the world has to offer. Sanford World Clinic's initiative was designed for Sanford Health to reach out, to share, and to learn. The World Clinic's initiative was one of several initiatives that resulted from a major philanthropic gift from T. Denny Sanford to Sanford Health back in 2007. The mission of World Clinics is to reach out to the world to have an impact on healthcare, but also to learn firsthand what it takes to deliver healthcare in different countries and in different parts of the world. We have an outpatient clinic in Kunming, China. It was one of the early relationships that we developed around 2009, 2010. Our partner, YMCI Healthcare, reached out to us and said, hey, would you help work with us and look at our inpatient pediatric program as well as our neonatal services? Dr. Dennis Stevens, who's a neonatologist here at Sanford Health, went to Kunming. And he now has gone to Kunming on 4 different occasions, and he is scheduled to go back to Kunming in March. Kunming is a community of 7.5 million people, and the hospital that we work out of is a brand new facility, 1,200-bed hospital. The standard of care for neonates in that region is that if a child is born around 26 weeks gestation or earlier, they pretty much let them go. At Sanford Health, we have a really advanced neonatal program, and it's routine for us to take care of neonates that are 24 months, even down as close as 22 months, 22 months gestation, which gets to the point where many organs and systems are not even developed enough to sustain life. While Dr. Stevens was present in Kunming, there was a young child who was struggling for her life. She was 750 grams, and she was right on the line of that 26-week gestation. Her physicians were at the point of making a decision to let her go. So hang on to that thought and that story, and I'll circle back here. Through our journeys and interactions, our partnerships, we have hundreds of stories that we're seeing the impact of World Clinics. We're making a difference, and many times it's one life at a time. I frequently get asked the question, why is Sanford Health doing this World Clinics initiative? And I personally think there are 5 reasons for why we do this project. The first reason is around organizational learning. From the very beginning, when we were set out on this, we said we want to learn firsthand how healthcare is delivered in other parts of the United States, but also other parts of the world. And we want to learn firsthand how healthcare is financed and paid for in other countries. But the learning goes much broader than that. The Sanford World Clinic platform really offers an opportunity for shared learning for our physicians, for our staff, for our nurses, for students, residents, and partners in our partnerships. And some examples of that shared learning can be things as simple as participating in continuing medical education or attending grand rounds. At Sanford Health, we have, in our oncology program, we have a multidisciplinary team approach, a conference they call it, where a individual patient case is presented, and you'll have a vast number of physicians, from a surgeon to a radiologist, pathologist, oncologist, the list goes on. Many physicians that have anything to do with that, potentially that patient. And they talk about that patient, and they come up with a treatment plan. Those moments are amazing, rich educational opportunities and relationship building. Soon, we're going to be having oncologists from Ireland and oncologists from China having the ability to participate in those team conferences. In addition to those types of activities, the World Clinic platform also provides a portal for global experiences and education. At Sanford, we feel that we have a lot to offer. We have a lot to gain as well, and a lot to learn through this whole shared learning process. An example in Vietnam, our partner there, as soon as we went there, one of the things that was very evident to us was they have a very high level of customer service. And as we work with them and interact with them, there are many things that we look at and say, these are pearls, these are pieces that we need to take and bring back home and adopt into our process. So it's a two-way street. So shared learning broadens our thinking as an organization, and it has a profound effect on the individual as well. The second reason for why we do World Clinics is that we're looking to build relationships and partnerships. And I can tell you thus far, in the relationships that we have developed, that these are deep and meaningful relationships. And as an organization, we value these relationships. It's through these relationships that we actually that open the doors for possibilities and new projects as we go forward. We also learn from those partnerships that has a direct effect on our culture here at home in a very positive way. And it enables that learning platform that I spoke of just a minute ago. The third reason for why we do Sanford World Clinics has to do with brand and reputation. And let's face it, there are very few people that know where Sioux Falls, South Dakota is, or where Fargo, North Dakota is, or who Sanford Health is. And we feel we have something to say. We have a story to tell. We want to make a difference and make an impact. So brand is important. A fourth reason is around recruitment, retention, and frankly, individual fulfillment. As I look at this program that we've put together, I really think that what Sanford has done is very unique. There are very few organizations around the world that are doing it to the depth and breadth that we are. Many people that are looking to participate or be a part of an organization, a dynamic organization, are looking for opportunities where they may have a global experience. Or even just as important or more important is that the work that they do every day, they know can have and does have global impact. The fifth reason for why I see Sanford World Clinics is about impact. We want to make a difference. So let me circle back to this story. Dr. Dennis Stevens had the opportunity to evaluate that child that was struggling that I spoke of. He adjusted the ventilator. He proposed a treatment plan and some recommendations. And then in a subsequent trip, just this past December, Dennis was introduced to the patient that he cared for 18 months earlier. Kind of chokes me up. That's impactful, one life at a time. So what we are finding with Sanford World Clinics and through our travels and our partnerships is that we're part of a global community. And this global community, that we share many of the same desires and objectives. And when you look at those desires and objectives, one that stands out is we desire to have high quality care and great service for the people that we serve and the communities we live in. We also recognize that we have very similar barriers, challenges, challenges. And those things could be like financial, they can be access to resources, they may be political. The list goes on. So at Sanford World Clinics, we're making the world smaller. We're bringing us together to work on healthcare solutions that we all face, same ones that we all face around the globe. Sanford's mission is to improve the human condition. And we desire to deliver that as close to home as possible around the globe.